Okay, so this is Denise DeSalvo, a nurse anesthetist that I was liking to interview for my third winterim. So my goal is basically for the interview are just to find out what it takes to be a successful nurse anesthetist. So like medical school and anesthesia school, and just find out how a hospital runs overall, and just like about your job.
Okay.
Okay. So we can just start with our questions. So my first one was, what level of education was necessary for your career?
Okay. Well, that's actually changed since I've been a CRNA. When I went to school, I had to, so I guess I'll start from the beginning. You have to go to nursing school. You have to have an undergraduate degree in nursing. Okay. That doesn't mean you can't, you could go to like undergraduate and major in chemistry, but then you would have to go back for a nursing degree of some sort, like an associate's degree or something in nursing. Then you have to work as a nurse in the ICU for at least a year to even apply for anesthesia school. Okay. And then when I went to school, it was a 2-year program. Okay. And so I came out with a master's degree. But now the requirement is actually a 3-year program and a doctoral degree. So it's actually updated. I think that it's not mandatory until 2 years from now, but most of the programs have already switched over.
Oh, wow. Okay. So you can major in what you want, or you have to do nursing?
You can major in forestry. I mean, it really wouldn't matter, but eventually you have to have a degree in nursing. You could go back to, for example, one of my friends, her son graduated from Carolina with like a degree in business and decided that he wanted to be a nurse anesthetist. And so what he's doing now is he's doing like an advanced nursing program. It's like an 18-month program of some sort, I think at Winston-Salem State, maybe. And then he's working in the ICU now, and he'll be applying anesthesia or so after he gets his experience.
Okay, that makes sense. What did you major?
That makes sense?
Yeah. What did you do though?
I majored in nursing. Yeah. So I started off the get-go in nursing school at Boston College.
Yeah.
And then I worked in the ICU at the University of Pennsylvania. Mm-hmm. And then I had to take a statistics class because I did not do that in undergrad, because at Boston College, stats was known as a GPA buster. And so I did that actually when we moved down here, and then applied after I took that class.
Okay. That makes sense. Okay, so that leads me to my next question of what was the hardest part about anesthesia school?
That was a long time ago. Probably the hardest part of the anesthesia school was just managing your time, because you're doing didactic classes and then you're doing clinical at the same time. When I went to school, and I think it's still like this, you do kind of like 6 weeks of front-loaded, like learning about gas machines and anesthesia equipment and monitors, okay, and things like that. And then basic anesthesia information. And then after 6 weeks, you go into the clinical arena 4 days a week. And so you're kind of balancing your time, because you're constantly preparing, but you're also having to go back and study for tests and do papers and do all that type of thing while going to clinical, getting up super early, and that kind of stuff. So that was probably the most challenging, is just balancing it all.
Yeah. How like difficult would you say like the transition is, just from like undergraduate to like having to do like something like that?
That probably was the first time that I actually ever needed to study in my life. Was anesthesia school. It's just a lot of information kind of coming at you rapidly. It's more difficult. And I don't think it's a more difficult thing, because that's all you're doing, and you're actually doing something that you're interested in, versus an undergrad. Sometimes you're taking silly courses that you really have no interest in. It's just a requirement. These are all actually interesting anesthesia relevant classes, with the exception of some of the core nursing classes, which are kind of silly, but for the most part, they're all relevant. It's fun.
Yeah, that makes sense. Okay, so enough about education and stuff like that. So what does a typical day look like in the hospital?
A typical day in the hospital. So we get there earlier than everybody, because we have to set up our room. Okay, so I tend to get there super early. That's just kind of my nature. I get there around 6 o'clock in the morning. We don't have to have first patients back to the operating room until about 7:15. So my goal is always to kind of go over to the day hospitals, talk to my patient and be ready by about 7:10. But I usually get in there at 6 a.m., get changed, okay, because you can't wear your regular clothes. You have to obviously wear, different clothing. So you have to wear scrubs every day. Then I go into, we have like a separate, like what is called an anesthesia workroom. And it just has different drugs. It's got a big giant drug dispenser in it. And sometimes that has different drugs in there than we actually have available to us in our room. And as I look and see what I'm doing that day, I might have to grab a couple of different things out of that machine. And any other like special monitoring equipment that I might need. And then I go into my room and I set up. And so what setup involves is checking your gas machine. And so that's a big part of your anesthesia, learning experience is really knowing how to actually take apart a gas machine and put it back together. So you have to know how the entire thing works mechanically. So if there's a problem with it, and as I'm checking in the morning, if there's some type of a problem, I can fix it. Now, sometimes there's stuff in there, if there's something that actually fails, that's like inside the machine, I can't fix that.
Yeah.
But there's a lot of things I can troubleshoot and fix along the way. So once I do that, I check out drugs and I draw up drugs for the patient. And that's kind of, there's certain drugs that we always use, and there's certain drugs that, it'll be patient dependent. So I'll log onto the computer, I'll look at my patient, I'll look at their past medical history, I'll look at their past medical records and the anesthesia records if there are any. Mm-hmm. And then I just kind of start figuring out what I'm doing, what drugs I want to use for that patient based upon their medical history, and draw those up for the day. If it's a case that I'm going to do a general anesthetic for, I'll get, my airway equipment out and make sure that's all in good working function, kind of just get everything ready for the day. And then I'll actually, even if I have time, start looking at my cases for later on in the day, and kind of see what I've got coming up, and if I need anything else in my room that, I wouldn't already have in there.
Yeah. Okay. How many like cases do you usually like do per day?
It honestly depends. Some cases are super long, like some of like the orthopedic spine surgeons. They'll do cases that can last, 6-7 hours during the day. I don't usually do a lot of those because I've been there for a long time and I don't like them. They bore me. Some people really like them. It's just, personal preference. I don't like to go to the surgery center and do super healthy people and super, that kind of stuff also bores me. I tend to do probably between 4 and 5 cases a day. Most of the cases are about an hour and a half to 2 hours because I do a lot of general surgery. I used to work with your dad a lot. So usually most of his cases and those types of cases were about 2 hours long, somewhere between an hour and 2 hours. And like I said, but it can totally vary. We can do things as quick as 10-15 minutes, for a little case that somebody needs just a little sedation. Or like I said, those orthopedic spine surgeries are probably the longest ones that we do.
Yeah. So you're not just like limited to like working with general, like you do, like.
No. When you're working in the operating, now some hospitals are different, right? Some hospitals, like say they don't have obstetrics, so they don't, you don't do C-sections, or some hospitals don't do neurosurgery. Okay. Some hospitals don't do children. We pretty much do it all at High Point. We kind of always have. We may do more stuff, more frequently, like general surgery more frequently and orthopedic surgery more frequently, but we still do hearts and lungs and, so it just kind of depends. And you don't really get to pick what you do. So you have to know how to do everything, so it's not like I can just say, this is all I'm doing. That's the only kind of, surgery I like to give anesthesia for, and that's it. So.
Right. That makes sense. So your job in the operating room, like how do you stay the whole surgery no matter what you're doing, right? Like how attentive do you have like to be, like, because I know there's like so many people in the operating room, and like I only know like really the surgeons, like
okay,
I did like my dad and stuff, but like what's how like I guess
how
like,
attentive do I have to be,
and how like I don't know, you know what I mean? 'Cause, like, surgeon.
No, that's a good question. Anesthesia is probably the most attentive person in the room, in all honesty, probably even more attentive than the surgeon. And you have to be a multitasker. Okay. So I'm paying attention to what the surgeon is doing, if they're losing blood, if they're pulling on something that may cause some type of physiologic reaction in the patient, paying attention to their vital signs. I'm paying attention to their ventilation. I'm paying attention to probably between 10 and 15 things every single beat of their heart. Like, it's a very attentive thing. That's not to say that, I can have a conversation, but
Yeah.
what I do, and I think most of us do, is there's a pulse oximeter. I don't know if you've ever seen one. They've put a little thing on your finger and it lights up red and it goes beep, beep, beep. We usually have the sound on for that. And so I'm very in tune to the sound. So, I mean, that gives you an idea of two things that are going on with the patient. One, that they have circulation, right? Because their heart's beating. Otherwise, you won't have anything. And that two, it tells you what their oxygenation level is at that time. And I can hear it. So if it changes at any time and I have my back turned because I'm looking at something else, I mean, yeah, I turn around and swivel based upon the tone change in that. And that's just something you get used to over time. But anesthesia is the person in the room that really has to have probably the best attention span out of everyone and be able to multitask more so, because I have to be able to be in charge of the entire room. If I need help, I need to be able to make sure somebody's paying attention to me that can call for help. If I need blood, there's multiple things during an anesthetic that can go wrong. Most of the time it's super smooth and super easy, but you have to be available. But the people in the operating room so there's a circulating nurse. So that's just somebody with a nursing degree. It could be a 2-year associate's degree. Okay. And that person helps the scrub tech kind of get ready for the case. They check in the patient with you, but they don't really they don't do anything really medical with the patient other than just kind of check them in, do the counts for the equipment and stuff like that. Then there's the scrub tech. And so that's the person that hands you out instruments. Okay. And make sure that the table's set up, make sure that they know what type of procedure we're doing and we have the equipment to do that surgery. Okay. And then there's the nurse anesthetist in the room at all times. So the nurse anesthetist stays in the room. Where I practice, we work with anesthesiologists, but there is one anesthesiologist to 4 nurse anesthetists. Some days I hardly see my anesthesiologist at all, if at all, in the room. Okay. That doesn't mean they're not paying attention. It doesn't mean they're not doing what they need to do. It just means that most likely they're in other rooms with maybe less experienced people or sicker patients that they're actually redirecting their attention to them. Okay. So it's a very autonomous practice. I don't really see them and talk to them unless I have a question or we're doing something that I really need them for. I'm trying to think how many states it is now. There's maybe 18 states in the United States that require absolutely zero supervision of nurse anesthetists at all. So nurse anesthetists can practice completely autonomously, and most of them are like the more rural states. And they have a harder time actually getting people in, right? Because, who wants to live in Montana, in the middle of nowhere, but they still need anesthesia there, right? They have people there. There's some places in California now, which I was kind of to see that actually don't require supervision. But the supervision rule does not mean it's an anesthesiologist. And that's kind of where nurse anesthesia gets really kind of a gray area. And they kind of have turf wars with the anesthesiologists. Oops, sorry. So I can practice autonomously with your dad. Yeah. And he doesn't know anything about anesthesia. He knows a lot about medicine, but he knows very little about anesthesia and what's going on. But he could technically say that he is the supervising physician. Yeah. Okay. Does that make sense? It just has to be a doctor, any doctor in the room in the states that require that.
Okay. That makes sense.
So there doesn't have to be an anesthesiologist.
Yeah. So what is the main difference between you and an anesthesiologist? Is it really just that supervision thing or
It's the educational component, in all honesty. So, a anesthesiologist goes to school for 4 years. Okay. And then they go to medical school for 4 years, and then they do their residency for 4 years. Okay. A nurse anesthetist goes to school for 4 years and now does a 3-year doctoral program. And then they have the 1 year, I guess, of, in between those two components where they do ICU. So, and then there's a salary difference, and a reimbursement difference. So, we make probably about $150,000 less than they do a year, but our salaries are pretty high. There's also another anesthesia provider now called an anesthesia assistant. Mm-hmm. You don't see a lot of them. You don't hear a lot about them. They make probably about 2/3 of what a nurse anesthetist make. Mm-hmm. It's kind of like a PA, but they haven't gained a lot of pretty because they're just not trained. They're, nursing, if you think about it, when you go to nursing school, you spend 4 years learning about how to take care of patients and all their, complicating, medical diseases and, you know, what we do to treat those and about pharmacology and all that, right? And then we spend 3 years now learning about anesthesia and what we, you know, how anesthesia manipulates that and those different drugs and the different things that can happen under anesthesia. Well, the anesthesia assistants, basically, they have 2 years. That's
Yeah.
it. They actually learn everything about taking care of people from, you know, taking a blood pressure, something
Right.
that simple from taking a blood pressure to actually delivering an anesthetic.
Yeah.
So that's why they're not reimbursed as well. And they're not actually, I don't even think they're licensed in all states. I think it's only a little bit less than half.
Yeah, I've never even heard of that, like as a,
Yeah, it's kind of interesting. It's not in a traditional PA school. So you
Yeah.
can't be like, you know, it's not in a traditional PA school.
yeah.
But like
So-
Emory has a program.
Okay.
Right?
Yeah.
Yeah.
That makes sense. Okay, so yeah, basically like the schooling difference is like the main part because they have
The
to.
schooling difference is the main part. And then, you know, they're a physician. We're just in completely different disciplines. We're in the nursing discipline. They're in the medical discipline, but we do the exact same thing. We're licensed to do the exact same thing.
Yeah, that was like my biggest, like when I was like thinking about like the differences, because I was like, don't they do the same exact job?
We do.
Yeah.
We do the same exact job. I like working in the job that I work at. I love working with an anesthesiologist. It's just nice to have a team member. Like if something's going on and I have tried to fix it and I can't fix it, it's just nice to have somebody else to run it by, be like, okay, this is going on. I've done this, 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 and this, and it's still not fixed.
Mhm.
Do you have any ideas? And so that's a nice component of, you know, working in a collaborative process with an anesthesiologist.
Yeah, that makes sense.
And we've got a great group. So
Yeah, definitely. Okay, so how did you ever think about like going to medical school and being an anesthesiologist, or did you always like how did you choose like being a nurse?
nursing anesthesia.
Yeah.
Actually, I went to nursing. My sister was a nurse, and I just was like, oh yeah. So when I was in nursing school, I went home with one of my friends for the weekend in Boston, and her father was a nurse anesthetist, and that man spoke so highly of his career. I mean, when he found out I was like in nursing, he's like, you have to be a nurse anesthetist. It is the best job. Like I've never like met anybody like ever that loved their job as much as that man did. All he did the entire weekend when I saw him was try to talk me into it. And I didn't decide at that point, but I was like, I never really heard of a nurse anesthetist. What, you know, kind of like, well, what do they do? I mean, he really seemed to like his job and he seemed to be well reimbursed for his job. They had a lovely home. He was sending his daughter to Boston College, which is not a cheap university to send your child to. I'm like, you know, so it was kind of in the back of my head. And when I started my nursing career, it kind of moved to the forefront of my head because I didn't love nursing. I think at this point in time in my life, in fact, I don't think I would not be practicing at all. I would be sitting at home, stay at home mom. I would have never gone back to work after I had my kids. No way, no how, I wouldn't have done it. But nursing is just not an autonomous practice. It's very limited and that's okay. It just was not really what I liked. You know, I think that nursing anesthesia is for people who are very strong-willed, very type A, very outspoken. There's outliers. Every once in a while, we'll get a student that comes through that's a little quieter, and that not really kind of like as outspoken, but you realize that, you know, you're that patient's voice during that anesthetic. And so you have to, there are times I have had not knockdown dragouts, but just like utter stalemates with people. I'm like, that's not happening. Not doing that. That's just, you know, and you have to be able to do that. You have to be a strong-willed person and know and very confident in your decisions. And you get that through training. Obviously, you know, you learn things and you can back whatever you say up with your education. But you just have to be very, very type A, very strong-willed. And that's kind of how most of us are. It's kind of interesting. It's like we're all the same person.
Yeah, that's funny. Okay, so let me think. So what would you say is the favorite and least favorite part about your job overall?
Okay. Most favorite job is the autonomy that it brings from, you know, just, you know, practicing anesthesia to the scheduling. I mean, there's not a whole lot of careers out there that you can go to school for and then work part-time, which is what I've done for the past 20 years. Okay. And still make a decent salary and say, wow, I actually, you know, make enough money to either afford childcare for my child or just to make it worthwhile for working. And you can work anything in nurse anesthesia. You can work weekends, you can work evenings, you can work, at a little GI clinic just doing sedations. You can work in a surgery center if you only like, you can work in a big heart center if you only like doing that. You can work in a pediatric center if you really like kids. So there's so much diversity and there's so much flexibility with your job. It's amazing. It is a great profession. It's for intelligent people, and it provides an amazing salary for the actual amount of schooling that you have to go to. My school was so ridiculously cheap. They're not as lucky now. Wake Forest has charged them Wake Forest prices now for, so they pay Wake Forest pricing for 3 years. When I was there, I think that it was less than $2,500, maybe $2,000 a year, something like that. It was ridiculous. It was so cheap. It was like it was ridiculous cheap. So now they have to pay more, but they're still making a great salary when they come out, and they're able to pay off their loans. They're able to get good schedules. There's a lot of time off. I mean, it's just it's a unbelievable flexible job as far as like if you like working evenings, if you like working weekends. So when you have kids, you can go back part-time. Some people only work weekends and they can work extra. That's the other thing that's nice. Like, say you want to buy a new car and you don't have enough money saved. Well, you can work an extra day. You know what I mean? Like you could work the call shift and just pick up an extra day, and you're making an extra, boatload of money, for the next couple of weeks that can help you put money down on something. And most jobs don't have that ability anywhere, really.
Definitely. So what is your least favorite part?
Least favorite part? I really don't know that I have a least favorite part. I love my job. It's a great career. I've enjoyed every minute of it. Maybe taking care of like emergent cases, because you don't have as much time to prepare. Well, you don't really have any time because they're emergency, and sometimes they come right up from the emergency room. That's kind of not my favorite part. I don't like taking care of pediatric patients right now. It's just not my favorite thing. It kind of has developed over the years since I had kids. Not my favorite, but we have plenty of people that like taking care of peds, so I don't have to.
Yeah. So I know you work part-time. So how many hours do you work on a normal week?
Well, pre-COVID, I was working 2 days a week, so 16 hours. I was working Mondays and Tuesdays, 7 to 3, going home and not working for the rest of the week. Since COVID, the schedule has been insane, because we kind of had that 6-week amount of time where we weren't running cases.
Yeah.
And it's just been super busy. We're short staffed. We have a CRNA that's been out with COVID for 2 months now and is not planning on coming back in this calendar year. So I have been coming close to working full time. So I'm working about 32 hours a week.
Oh, wow.
Yeah.
Increase.
But that's up to me. That's not like they can't make me. It's just, there's nowhere else to go. There's nothing else to do. I might as well work and make money. That's
true. That's true. Okay. So is there a difficult, or is there a certain case you've had that, a most difficult patient, or any bad complications you've had during surgery before, that stick out to you, a case or something?
Oh yeah. I mean, we've all had bad cases. We're not, because of HIPAA, I'm not really supposed to talk about them, but I mean, we've all had patients die. I mean, that's what happens, right? I mean, occasionally, despite everybody's best efforts, patients pass away. I've had, people deliver babies and have their babies be born dead. That's probably the worst thing I've ever seen. It's just traumatic on a different level. Because it just is. That's pretty gut wrenching. I've had patients that I knew the chances that they were going to make it through the surgery before they left were slim, and their family saying goodbye to them right outside the operating room doors. Those type of things, they stick with you.
Yeah, definitely. Okay. Do you have any? We'll change the tone. Do you have any funny stories from anesthesia school, or your clinical rotations, or anything like that? Or anything funny happen in the operating room?
Nothing really funny in the operating room. When I did my clinical rotation in Portsmouth, Virginia, I went to the military hospital for a month during school to do more regional anesthesia and stuff like that, where you numb people up. Oh gosh, Nick. Um, and so there was one night I was leaving the C-section room. It was about midnight and we were doing an emergency C-section, and I was leaving and I was speeding on base. I know you're surprised. And the military police pulled me over. And when I went to look for my wallet, I realized that I had left it in Gary's car when Gary had come up to visit me for the weekend. And they were like, well, we're calling your supervisor. And I'm like, they're not going to answer the phone. They're in the middle of the C-section, you know, it's before cell phones and all that kind of stuff. I'm like, they're not going to answer you. And so I almost got arrested by the military police, but I somehow talked myself out of it.
Oh my gosh. Okay. Okay, so just wrapping up now, overall, would you recommend this career to someone else and why?
100%, but it has to be the right person. You know, if somebody's super shy and kind of quiet, I had somebody shadow me a while back that, I mean, I knew they were just kind of interesting. It's nice when you get to come in and shadow because you not only get to see what I do, but you get to see what everybody does in the operating room. And that might open up your eyes to kind of what you want to be in the future, you know, be it not a nurse anesthetist, it could be, you know, a nurse in the OR or a perfusionist in the heart room or, you know, anything. There's so many different people that work up there. But this particular person was very, very quiet and very, very reserved. And I knew like 150% before they ever came in that they would not make it. So I would 100% recommend that to anybody who has like a strong personality and is intelligent and outspoken. And, you know, it's an amazing career. Totally love it. I would totally recommend it to anybody because of its flexibility and its autonomy. It's great. And in fact, one of the first Bishop students that I had shadow me is applying to nursing anesthesia school right now.
Oh, wow.
Yeah.
That's cool.
Yeah.
Okay. I think those are all the questions I have, and you definitely answered all my expectations and all my things I wanted to find out about the interview. The only thing I have left for you is the evaluation form, which I can just send to you. But,
okay.
Thank you again for letting me interview you. It was amazing, and I definitely, as you know, are interested in medicine, and this is just like another like option I feel like pursuing and like finding more about, definitely. So thank you so much.
Yep. You're welcome, Kate.
Okay.
Bye, Annie.
Bye.
Not saying bye.